Ladies and gentlemen, a warm welcome to this webinar entitled Pharmacy Perspectives on COVID-19 Vaccination. So as we are aware, while many of us are forced to go into self-isolation or self-imprisonment, if you will, we are more than ever intertwined in a way we never imagined before via the World Wide Web. Today's session is, of course, dedicated to pharmacists, particularly community pharmacists who have acted as frontliners, putting themselves, service above self, right? Without further ado, I would like to call upon our first speaker, very much anticipated talk from Datin, Mariani, Ahmad, Nizaruddin, who acts as the Vice President, one of the Malaysian Pharmacists Society, and is also affiliated with the University Cyberjaya. Without further ado, Datin, the floor is yours.
Thank you very much, Dr. Madhu. Assalamualaikum and good afternoon. I bid to all participants and also to the esteemed organizing committee of this wonderful event. A good afternoon to Faculty of Pharmacy, University Institute Technology, MARA, UITM, and all our very, very attentive participants today. Thank you so much for having me. I'm so wonderfully excited to share with you a very sort of not a heavy topic today, but more to share on the work that has been ongoing by the Malaysian Pharmacists Society Immunisation Advocacy Chapter, which began quite some time ago. So my title will be Role of Pharmacists in COVID-19 Vaccination, but it will also touch on a few other things. So next slide, please. Just to share, to put a face to all those that have been working towards several milestones in the immunization program. We have Mr. Amrahi as our advisor of the Immunization Advocacy Chapter under MPS, and Associate Prof. Muhammad Haniki of IIUM is our chairman, assisted by co-secretaries Ms. Harpreet and Ms. Dr. Nur Hafsan of University Science Malaysia, and our ever hardworking Mr. Lam Kai Kun. The reason I want to share this slide is because this chapter began 25th of February 2019, but remained very much at the back of the scene because there was just so much happening with the COVID situation. But the objective of this chapter was to harness the full potential of pharmacists in immunization through addressing barriers and challenges while providing robust evidence on the values of pharmacists managed immunization services in Malaysia. And this was a wonderful beginning because with this, I introduce you the next committee members. Next slide, please. We managed to mobilize so many pharmacists who were ready to give their support to help in any way they could. And I'm happy to say that the chapter has grown and grown, and it is by virtue of this invitation today to speak with you that we hope more and more will share our energy and enthusiasm to bring this chapter forward. Next slide. The title today of the role of pharmacists in immunization and vaccination has to be understood more in terms of the variety of roles that pharmacists play in healthcare. So I want to share with you this little pamphlet that was designed during the World Pharmacists Day to give some context to today's session. Pharmacists, we are doing so many things. We have been involved in research, as you will be having a session tomorrow with Pharmaniaga. We are involved in research and development, formulary and distribution. Of course, the primary area now would be the regulatory part, regulatory pharmacy, which the pharmacists at the National Pharmaceutical Regulatory Agency have been very, very diligently looking through all the materials and documentation to ensure that we have this vaccination available in the country. And so many roles. So sometimes we really have to take a look back and just to see how is it that one pharmacy degree can produce so many different roles. Well, we appreciate all these roles, but we have to understand also what our fellow pharmacists are doing in all these areas. And for the vaccination component, the area of logistics and distribution, besides regulatory, have been critical. The area of managing education, to provide education to patients about what vaccination entails, has been very critical. So I just hope that throughout this 1 hour session today, we will always fall back to these roles of what we do, which is advocacy and so many other things. Next slide, please. So I want to take us to the global perspective as to what the FIP, which is actually the International Pharmaceutical Federation. I'm happy to say that Malaysian Pharmacist Society became a member of this world body recently, about 1 to 2 years. And this has enabled us to collaborate more with the international bodies such as FIP to learn and to gauge many areas of collaboration with other countries. The distinctive roles of pharmacists in the COVID-19 vaccination, according to the World Health Organization and the FIP, has been studied already, and this is the chief areas of pharmacist-led immunization in countries such as Dr. Mumtaz will share, the United Kingdom, United States, Australia. They have actually gone into immunization itself. But in Malaysia, we are working more on creating awareness of vaccination benefits as well as advocacy, and also regulatory frameworks and reimbursement models, training, which is going to be covered later by me. I will talk a bit about that. So we are happy to report that all these developments on the world stage, we are beginning to start this even in Malaysia. So that's very good news. Next slide, please. Just looking at what the pharmacists in other parts of the world, they have been involved in the task force planning, and they have been vaccinating their pharmacists of 8,000 immediately. So we have to do a lot of catch up too in Malaysia, but that's where I'll share with you the next session afterwards. And in United States, they have even called upon United States pharmacists to do full implementation, rolling out of the administration of the vaccine, because they are all certified pharmacists in vaccination. And for those who are allowed to vaccinate, it is part of the system. Next slide, please. And what I want to now discuss more about in our context of pharmacy in Malaysia is that we at this stage of advocacy, and that is like me coming here today to discuss with you more of what we are trying to accomplish in Malaysia, is for a person to advocate for a interest or cause. And our cause has been quite a few. One of that is to educate our community and our public about getting out of this COVID-19 by vaccination, and also handling a few of the a lot of the queries that come from the public. And that's where community pharmacists have a very big role. So we needed to get more and more pharmacists on board to know some of the concern areas of the public. And that is why we developed this chapter. Next slide, please. Okay, and why and what are we advocating for? Okay, next. Well, it's very simple actually. Because we started very full on with the COVID situation, I just want to share what we had to go through in the beginning. Next. In the beginning of the COVID crisis last year, we got in touch a lot with our pharmacists in the government sector, where they were very concerned about their health and the fact that they were meeting a lot of the public, and they were concerned about those patients who were not entirely sure of their COVID-free status. So we had to do a lot of advocacy work in trying to maintain the mental health component of a lot of pharmacists who were feeling very overworked. And so this is where we had to open up discussions, and some of our pharmacists have opened online mental health sites and so on, just so that pharmacists could start talking to one another about some of the stress they were going through, especially when they are working in the front line with patients. Next slide, please. And what we did was we ensured that community pharmacists were always, recognized for their very, very hands-on approach, because interestingly enough, 2019 recognized the community pharmacy as essential services, as it should. And therefore, we wanted to show support to all the community pharmacists by sending out face masks. This was at the time when a lot of issues were happening with the face masks. There were not enough stocks and so on. So that's one of the things we did. The little picture on the right are actually all the amalgamation of individual photos of pharmacists that received masks. And this was our way of saying thank you to all of them. The next slide, please. So with all that in mind, this is what happened. People were very, very excited to start to put in a lot of cooperation with all the other healthcare professionals and so on. And next slide. And then there was a need to promote a lot of proper education on COVID. At the time, I think all of you agree that the amount of information and sometimes misinformation that was going out through all the channels, some through WhatsApps, Telegram, phones, anything. There was so much information. So the chapter decided that it somehow had to try to help the pharmacists who were deluged with a lot of these inquiries. And so we created some materials for them. So I would say our advocacy role as pharmacists was to get the information that was as accurate as possible. So this is some of the education. Next slide. I'll go through all the materials that had to be created for pharmacists to be more ready in handling the public. So there was a development of the COVID-19 guidance document for Malaysian pharmacists. And this happened because of the collaboration between the MPS with the FAPA Philippines especially. The guidance document helped some of the pharmacists to be more sort of like ready for the SOPs that were later rolled out by the MKN, or the National Security. Yeah, and this helped the community pharmacists at the time to be able to have guiding documents to support their very, very hard work that was going on the ground. Next slide. So just to share with you, one of the roles that pharmacists adopt in advocacy is to prepare to start on how to advocate for vaccination to consumers. It's something that we learn in university when we do courses like social pharmacy or even community health, public health. But it is very important that before we start the journey of teaching or educating the public, we need to know on how to handle some of the potential issues. And one of the issues is the high hesitancy or the mistrust towards the benefits of the vaccine. So pharmacists' role has to not only be education, but we have to arm ourselves with a lot of literature to read up on, and how to handle those who worry about unforeseen effects of the vaccine, concerns about the companies that are being able to handle the vaccines, and also some of the naturalists who prefer natural immunity. So this paper, Understanding the Dimensions of Anti-Vaccination Attitudes, is a social psychology paper, and very important for us to maybe have a read through to get ourselves better underprepared on how to handle our, our individual customers and patients. Okay, next slide. So I'm going to just skim over these next few topics here, because this is all the information that you would have seen. So our major role was to actually rummage through all this material to see what can actually be believed and not believed. So let's go through. Next slide. So at the time of March 2020, there was a lot going on, and our role was to check what information could be correct, what information could be sensationalized, and how we were going to approach it. So the chapter would come up with a few educational materials, and however, a lot of the information was sent out by the president of the Malaysian Pharmacy Society, Mr. Amrahi Buang, as a way to calm the commotion that was going on at the time. Yeah, so there's a lot of news that happened. The next slide. And as we approach 2021, the momentum picked up because a lot of the agencies such as the MOSTI and also the National Security Council recognized that pharmacies playing a dual role of being essential supplier as well as a retailer. Partly because we had to speak to the Company Commission of Malaysia to ensure that they understood that pharmacy is not a retail alone, but a pharmacy is also providing health service. We began to try to include the role of pharmacists towards patient advocacy and asking the government to include them for the vaccination program as well, community pharmacists. Next slide. So as you see, as lately as February, there's been strong support by the Pharmacists Society to let others that are frontliners also be ready for this inclusion into the first phase of vaccination. Okay, next slide. And some of the work that happened here happened most of the time by pharmacists who were very passionate about the East, what is happening in East Malaysia. So Labuan was very active. Next slide. And where we are now for the next. Some of the press releases that have gone out have been to include pharmacists in the first phase of the national vaccination program. As we know, those who are vaccinated will then be able to propagate the advice for the customers to also be vaccinated. So this is the walk the talk, so to speak. Next slide. And we had a lot of support from the associations like FAPA. For everyone's benefit, FAPA is the Federation of Asian Pharmaceuticals Association. So a lot of the pharmacists in the Philippines had been very vocal early on, and they had already been able to be enlisted as vaccinators. Yeah, they themselves can perform the administration of the vaccine. So we take the lessons that we can learn from other counterparts within ASEAN region. Thank you. Next slide. And we joined forces with FIP and FAPA to try and recognize that we have a role to play, not only in advocacy, not only in regulatory affairs, as you will hear tomorrow, but also that pharmacists that have graduated from other countries and now residing in Malaysia are actually able to perform the vaccination and administer to patients. As you are well aware, some countries like United States, United Kingdom, Australia, they provide vaccination training to their pharmacists, and because of their healthcare system, they are entrusted to administer, especially around emergency times such as flu vaccine and so on. So one of the ways we try to move forward in Malaysia was to get the international collaboration of our world body and our ASEAN body to expand our role. Next slide. In order to also solidify our role in Malaysia as an essential healthcare worker, we also wrote to MOSTI, and the feedback has been quite positive. Next slide. So our roles, as you can see, has been not only limited to education and be an advocate, but also through sharing our potential role in administration. But just these are some of the aspects that we have covered, a lot of immunization webinars, and we also look forward to all of you attending here today. If you would like to do seminars or webinars, please, we can collaborate. So these are some of the materials that have been produced. Next slide. And also our motto of service to the community through advocacy and awareness has gone through to every level of society, to all strata of society, and all ethnicities have benefited. So this is the wonderful, one of the byproducts of disaster, that when you know that something has to be collaborated on, we can work wonders. So this is the beauty, in a way, a blessing that we have worked in a very cohesive manner when there was a sense of crisis. And I would say that this is the strength of any society, that they can come together for the good of all. Next slide. So some of our speakers have been advocating for roles of pharmacists, and all this will not happen if we don't get pharmacists ready. So this is why the next slide shows you, yeah, these are some of the events happening and all by pharmacists. But the next slide will share with you a very, very pivotal moment. I do not know if some of you remember, this was the day that the Prime Minister of Malaysia received his vaccine. And they chose to highlight on this very day the entire process of the distribution and the integrity of the vaccine cold chain supply. And this lady happens to be a pharmacist. So the pharmacists were recognized and in a primary role of being very critical in the logistical supply. Sometimes we overlook this, but it is such an essential part of the vaccination program to maintain the integrity of the vaccines. Thank you. Next slide. Also, a role that we cannot forget, as the National Pharmaceutical Regulatory Agency, it has provided pendaftaran bersyarat or conditional registration. There is also a lot of data that has to be fed back to the authorities, and this is actually permission of the NPRA, that pharmacists have a lot of roles to play in terms of the reporting of any side effects or adverse events. But thankfully, as mentioned in a few sessions of video yesterday, the feedback on the vaccine has not produced any significant adverse events. There have been side effects and expected events, but there has not been anything too alarming. So this is where pharmacists have a role to play to assure the public that whatever it is, they can always talk to the pharmacist about any side effects that they feel might happen or whatever, but always to calm them, yeah? Then next slide. So as we know, the pharmacist has a very big role in pharmacovigilance, and if need be, these are one of the areas that you have to be prepared for. The role of knowing how to liaise with the reporting institution. Everything is now miraculously available online, where the professionals do their reporting for AEFI, Adverse Event from Immunization, and as you know, it is also included in the MySejahtera app. I think one of the benefits of doing such an exercise of adverse event is to actually be providing all this essential data back to the manufacturers of the vaccine, and also the fact that people begin to recognize the role of the pharmacist as a medication custodian. Yeah, the custodian of vaccines and medicines, so that they identify the pharmacists in terms of providing more structure towards safety, efficacy, and quality of any products that have been registered. Yeah, next slide. So one of our biggest roles, of course, as advocates, next. Obviously, a lot of things have been circulated, and I think, as you have seen, there has been a lot of ways to get yourself updated, but the chapter felt it was necessary to standardize or to streamline the information. So before you could advocate and exercise your role as an immunization advocate and create awareness, you need to equip yourself with the knowledge. Next slide. So a lot of infographics were prepared by the Malaysian Pharmacists Society Young Pharmacists Chapter, as well as the MyPSA, because in our very busy life today, you know, where you get videos sent to you and you get messages sent to you, how are we going to vet? So one of the ways to vet is to just go online to the MPS website to get all this information. And interestingly enough, with today's world, anything that is displayed in an infographic is much more easy to understand. So this is the way that technology and design has helped educate easily. Yeah, next slide. Some of the other areas, of course, pharmacists were inundated, especially in community, to understand more about vaccination process, how to store, especially in government sector. They were responsible to maintain the integrity of the entire cold chain system. So they had to update themselves on knowledge about the vaccines coming into the country, about the different storage, and also the reconstitution of the storage. So a lot of things, as our role of our pharmacists will also to also look into all the medication expertise area, yeah, and the vaccines expertise. So we needed to go back. Yes, next slide. So we needed to ensure that our role can be further recognized and further appreciated. We ourselves had to begin to study all this. I mean, the vaccination process program that we have been handling before, like the National Immunization Schedule, we have studied it a bit, but this was now something that was totally new. So we had to arm ourselves with enough knowledge. You can all have a glance through this, through the websites of MPS, or even through these notes, but I won't cover all these different aspects now. Next slide. The only thing that I will cover is to share with you that the major question that customers and patients ask pharmacists is, how come this vaccine can be rolled out so fast? Is it safe? So we have to understand that and calm our patients, that they have to understand that anything that is going to be registered with the NPRA and approved by the Drug Control Authority is definitely going to be well researched and well documented. So this is one of the ways for us to ensure that with provisional registration, we continue as pharmacists to provide the data safety aspects of it. Yeah, next slide. So for us to exercise our role, obviously we would like to advocate for the AEFI reports to be made public, and we understand from NPRA's session yesterday that actually the incidence of adverse events has been very, I would say, remarkably safe. Okay, it's been towards the expected side effects such as, of course, slight pain at the site of injection, and whether or not the procedure was carried out well enough in a certain place, has been just a slight feeling of nausea, but everything in a controlled environment, it was okay. All right. So now what we have in our planning is to advocate for pharmacists to provide registration for public. We are trying to mobilize as many community pharmacists to help with the registration process, because there's quite a large number of public that do not register yet. Next slide. And for this, these are all the education material that have been produced by the chapter, and this includes all this. Next slide. Okay. The next one. Yeah. So basically, obviously, we have to highlight to everyone that the pharmacist's role has changed also, because we are no longer Malaysian Pharmaceutical Society, but we are Malaysian Pharmacy Society. Next slide. And all these resources you can actually find online. You can follow Instagram and so on. There's many sites. So I guess the greatest challenge now is to see which one you want to follow so that you can better advocate your role. Yeah. Next slide. So this is something I would like to share with you all as you are the youth of the nation. There is the Malaysian Pharmacists Society Young Pharmacists Chapter that have been preparing a lot of material. I hope in future maybe you would like to get on board with them. Next slide. And the next. So they have prepared so much material, and thank you to them. Next slide. Most of our materials that we have produced to help pharmacists in their roles for advocacy have actually been derived primarily from tertiary sources such as the Malaysian Vaccine COVID website. And this is the official site. Next slide. And we have been following closely the official resources. So as pharmacists, we would like everyone to also refer to these documents. Next slide. And what I would say to be the greatest challenge for pharmacists today in our role is to be able to vet the information that comes out. Yeah, and there's a lot of continuous education that we have to do. I know most of you are probably at undergraduate level or postgraduate, but once you become a registered pharmacist, there is also a requirement of at least 20 CPD points of continuing professional development, continuing pharmacy development, points of 20 points per year to accumulate in order to continue with your retention of certificate. So as pharmacists, we go forward, we keep on learning, we keep on keeping in touch. So I'm very happy that an event such as this is being planned. Next slide. So we are happy to report that we have an ongoing advocacy website. You can just visit the MPS website for further information, because in that site, a lot of things are being planned, a lot of things. Yeah, next slide. And that's our tagline, the MPS Immunisation Advocacy Chapter. Be wise, immunize, Immunisasi Pilihan Bijak. This is our official email for the chapter. So we of course welcome a lot of questions, a lot of support from you if you have any area you'd like to contribute to. I think this now concludes my last slide before the next one. Okay. All right. Okay, Dr. Madhumala. I have been able to finish the presentation in about, it's about 2:20. So if we have any questions before the next session. Okay, yes. There is a question from Ms. Nur Aliazatul Akma. She would like to know whether the pharmacists recognize the roles if we are to vaccinate the public. Okay, so Ms. Nur Aliazatul, yeah, Ms. Nur Aliazatul, one of the challenges that we face in Malaysia in our roles as pharmacists, whether in government sector or the community sector, is to actually create an identity, yeah, an identity of a pharmacist to the public. Sometimes when we actually look back into our original sort of standard roles of being a medication custodian, a medication expert, but then when we transgress into the area of administration of vaccine, we are now maybe perceived as taking on another role provided by other healthcare professionals. But the way to go around it or to solve this problem, obviously, is to have the proper certification and to be accredited as a professional, healthcare professional that can carry out vaccination. And strangely enough, the COVID era has highlighted something that actually vaccination by pharmacists has been going on for quite some time in other countries, and it is largely because of the flu epidemic and so on, yeah, in United States. So I feel that the public will only recognize us with the proper training and the accreditation awarded to the pharmacists to carry out that function. But I will cover more of that in my next session with you. Okay, I hope that answers. All right, any more questions? Do you have any more? Have I helped you answer? Ada Datin. Okay, sure, Nora. Sure. Okay, I will answer there. Okay, I have a question here. One of the participants would like to know, do we have anyone that already underwent training in USA and Canada and are managing the administration? Okay, all right. So in the Malaysian Pharmacists Society Advocacy Chapter, we did send out our vaccination form to find out who has already undergone training in their country, in the countries that they train to be pharmacists. So we have about 16 pharmacists that have graduated from United Kingdom and Australia and even the US, who have actually given vaccination in the countries that they are licensed to there. So for Malaysia, they are now going to start a program, which I will talk to you about in my second session, where we are going to offer a full course, accredited course, and pharmacists will be able to be at least handling the main components of vaccine administration. Yeah. Okay. Q&A boxes. So at the moment now, those pharmacists who have been trained will also be helping us in the program that we are going to carry out with University Science Malaysia and the Malaysian Pharmacists Society with in collaboration with Malaysian Academy of Pharmacy to guide pharmacists locally into how to administer. Okay. Currently in the phase 1 of COVID-19, I have another question. Currently, we are in the phase 1 of the COVID-19 vaccination and the manpower. And are we planning to include yes. Okay, so fortunately, after our many appeals to the Ministry of Health as well as MOSTI, the community pharmacists were also included. In addition to the government pharmacists that have already had their vaccinations, the community pharmacists were included, and they are included in the phase 2, which is rolling out in April. Just to share with you, pharmacists in Kedah, pharmacists in Johor, Segamat, community pharmacists, they have already started their vaccination program with the PKD, the Pusat Kesihatan Daerah is entrusted to handle the logistics. So even though the main planning comes from the Program Perkhidmatan Pharmacy or PSP, there's actually been a need to localize the planning, to localize the planning at the district levels. So most of the community pharmacists in certain districts have been contacted by their health authority, the Pusat Kesihatan Daerah, and they have to be licensed A pharmacists. Licensed A pharmacist means pharmacists that have actually applied with the State Health Department, Pejabat Kesihatan Negeri, to actually practice in that state and have a license A. So they are recognized to be receiving the vaccination. Okay.
Datin, there's one very interesting question on the procurement.
Then, because, yeah, sure. Can you read it out? Because currently the selection box is a bit tight.
Yeah, sure. So you know how with vaccines, normally the Bahagian pharmacy would sort of spearhead that. But now with the COVID-19 vaccines, MOSTI has been sort of taking the lead. Do you have any comment on that, or would you know any policies surrounding those issues?
Well, actually, the primary reason is because MOSTI is the Ministry of Science, Technology and Innovation, and is being handled by a very dynamic leader, YB Khairi Jamaluddin. I think that there was a need to do strategic planning and liaise closely with the National Security Council, MKN, whereas the Ministry of Health had another major role to play, and that was to handle the most active areas, which is the vaccination centers and the healthcare providers. So in any situation where there is a crisis or a national disaster, the collaboration is very important. But there is also a sense of panic when there are too many collaborators, because what happens is there must be stewardship, there must be leadership from they call it the command, chain of command.
Right,
so MOSTI took the chain of command. And when MOSTI took over the chain of command, but still complemented by the Ministry of Health, there was a need to basically ensure that the process can be streamlined. So as you know, tomorrow will be the NPRA, so you may get more valid information from them, because I don't think I'm at liberty to say more about that part, except to say that I have been involved with disasters before, and you'll be surprised, the number one aspect that hampers disaster is communication. When communication is poor, no matter how good the ideas, no matter how good the planning is, if the communication between different agencies is not there, the plan cannot roll out well. So the entire premise of taking command by MOSTI, I think, has been a good one. MOSTI also recognizes the pharmacists in NPRA, so that there is that kind of level of, I would say, observation that's going on. Yeah, it's not directly under one ministry, but it is several different ministries observing. So that is good. That is a good thing.
Okay, nice. There are some questions surrounding on the availability of the vaccines. To be made available, so whether the public would get choices, would we be able to, when do you see so actually able to walk in and sort of choose one of?
Correct. It also happens to be covered later in my next session, because as of 2 days ago, the media has reported that MOSTI is allowing the private sector to play a very active part in the procurement into administering vaccine in the private sector. However, as you know, vaccine availability is going to be a constraint. There's actually a process where governments around the world have already set up agreements to be supplied these vaccines, and they get first priority. But when the private sector has to clamor for vaccines, they are going to be sort of like second place, because they will have to come to an agreement to be supplied much later. They will not get the supply as fast as the government. And as you know, as was reported already, there was an increment from 500,000 frontliners to about 670. So the availability, a lot more frontliners and healthcare workers were getting vaccinated in phase 1. So that is a good thing, but also means that vaccines are now, having to be first priority, right, to be sent out through phase 1 and phase 2. So you can imagine private sector will be slightly delayed.
Yeah. So do you think it's more of sort of streamlining, primary care versus secondary care, as opposed to the professions? So it's not so much the hurdle of the, pharmacies versus doctors, so to speak, but rather secondary care versus primary care to do with clinics and so on.
Yeah. Are you referring to the phase 1 or the public phase? Because phase 1 is largely the frontliners, but phase 2 will involve the second phase of the patients themselves. So when you mentioned that, did you refer to the vaccination rollout in those centers or to the specific, in what context?
I suppose going forward, so not so much the frontliners, but more sort of reaching to the public, the general public.
Yeah. Okay. Well, this is a very, very, interesting. It's all about logistics and planning because there are about 600 over vaccination centers. Okay. And these centers are always going to be on standby. But I think there's a large responsibility of the people that are registering themselves for the MySejahtera vaccination. There seems to be some sort of like some sort of planning that's been done where everybody who registers for MySejahtera will actually be notified 3 days in advance before they go for their vaccination. So I think for the vaccination rollout, it's not so much about the primary and secondary, but it's more about how the priority of the MySejahtera algorithm is being handled. There's an algorithm within the MySejahtera that streamlines, okay, who are the high risks that have to undergo the vaccination. So I think everybody has to respect that process, because one of the things that is difficult for planning is when people start to think that they were left out. But actually, all this has been streamlined by certain, So I think we have to remain calm and respect that there is a process going on, although we don't know exactly what that process is, but there is some planning in terms of how the algorithm works and where the centers are, so that hopefully people will not be inconvenienced if they were to go to certain centers. So that has to be the primary consideration when we start phase 2, that the public respect the process and the public have faith in the system. And as you know, Dr. Madhu, there has been a bit of not only vaccine hesitancy, but a bit of mistrust. There's been a bit of mistrust at the current situation. So I think we as pharmacists have a big role to play. We have to assure the public, we have to assure our customers that they have to remain calm, but of course be on the MySejahtera app.
Yeah, I think that answers some of the questions here. The participants have been asking how pharmacists can play a role in the in the sort of information that goes into MySejahtera app. So either in the output or, so like you say, there's an algorithm and we have to be patient.
Yeah. And a lot of this information is not going to be information that is widely shared among the public. It's going to be more of our role as mediators. We are mediating the official information coming, and we are healthcare providers, and we must then decide, although we are consumers ourselves, but we are now playing the role as a healthcare provider where we have to give evidence-based information, not go on emotion. Sometimes, I'm just sharing what happens. Sometimes we hear a few people saying, oh, I've been told that I'm not ready, I'm not going to get it yet, but my friend has gotten it. So, so it's all this sort of like, could be potential panic if people don't remain calm.
Yeah,
I suppose we'll also touch on that a bit more.
Yeah.